Assessing abdominal health. A step-by-step guide for nursing practice. 1. Identify the patient. Rationale. Ensuring that you have the correct patient is essential to avoid any errors in care or assessment. 2 identifiers are the complete name of the patient and date of birth. Patients should know that they are identified properly. 2. Explain the purpose of the abdominal examination and answer any questions from the patient. Rationale. Informed consent and patient cooperation are crucial for a successful examination. Explaining the procedure helps the patient understand what to expect and reduces anxiety. Explaining the purpose of the abdominal examination and addressing the patient's questions and concerns is not only a matter of ethical and legal responsibility, but also a practical necessity. To ensure a successful examination, gain patient cooperation, and reduce anxiety and to build trust. 3. Perform hand hygiene. Rationale. Hand hygiene is a fundamental infection control measure to prevent the transmission of pathogens from the healthcare provider to the patient and vice versa. The primary goal of any healthcare provider, including nurses, is to ensure the safety and well-being of their patients. Performing hand hygiene before any patient contact, including an abdominal examination, is a direct way to protect the patient from potential harm. Healthcare providers, including nurses, have a professional and ethical responsibility to adhere to infection control practices. Hand hygiene is a basic and universally recognized practice that signifies professionalism and dedication to patient care. In summary, performing hand hygiene before and after patient contact, including an abdominal examination, is not only a fundamental practice but also a vital measure for infection prevention and control. 4. Help the patient undress if needed and provide a patient gown. Rationale. Proper exposure of the abdomen is necessary for a thorough examination, while respecting the patient's privacy and dignity. This practice is rooted in the principles of patient-centered care and is essential for delivering high-quality nursing care. 5. Assist the patient to a supine position and expose the abdomen. Ensure privacy. Rationale. The supine position is ideal for abdominal examination, and ensuring privacy is essential to maintain the patient's comfort and dignity during the procedure. To perform a thorough abdominal examination, it is crucial to expose the entire abdominal area. The patient may need assistance in positioning themselves correctly and lifting their clothing or gown to expose the abdomen fully. Assisting the patient into the supine position and arranging their clothing or gown demonstrates care and consideration for their comfort. Lying flat on their back with appropriate support helps patients feel more at ease and relaxed during the examination. By prioritizing these aspects, healthcare providers can conduct thorough and respectful abdominal assessments that contribute to positive patient outcomes. Thus, maintaining privacy should be there at all times to keep patient at ease and will trust you as their healthcare provider. 1. Inspect the abdomen for skin color, contour, pulsation, the umbilicus, and other surface characteristics, rashes, lesions, masses, and scars. Rationale. Visual inspection provides initial information about the abdomen's overall condition and may reveal signs of abnormalities or skin issues. Visual inspection helps identify external abnormalities and provides initial clues about potential underlying abdominal issues. 2. Auscultate all 4 quadrants of the abdomen for bowel sounds. By using the diaphragm of the stethoscope, use a systematic method. Rationale. Bowel sounds assessment helps detect abnormal bowel motility, which can be indicative of various gastrointestinal conditions. Auscultation is a painless and non-invasive procedure that does not cause discomfort to the patient. This makes it well tolerated by patients and conducive to a positive patient experience during the examination. 3. Auscultate the abdomen for vascular sounds. By using the bell of the stethoscope. Rationale. Vascular sounds assessment helps identify potential issues with blood flow or vascular abnormalities in the abdomen. This assessment helps identify vascular abnormalities, supports early intervention, contributes to patient safety. and complements the overall evaluation of the patient's abdominal health. It is an essential skill that aids in the detection and management of vascular issues within the abdomen. 4. Percuss the abdomen for tones. Follow the prescribed technique and arrangement. Rationale: percussion assesses the density of underlying structures and can help identify areas of fluid or gas accumulation. 5. Palpate the abdomen lightly in all 4 quadrants and then palpate using the deep palpation technique if the patient complains of pain or discomfort in a particular area of the abdomen. Palpate the area last. Rationale: palpation provides information about tenderness, masses, and organ enlargement. Starting with light palpation minimizes patient discomfort. 6. Palpate for the kidneys on each side of the abdomen. Palpate the liver at the right costal border. Palpate for the spleen at the left costal border. Rationale: specific organ palpation helps identify any organ enlargement or tenderness that may indicate underlying issues. Palpation of specific abdominal organs, such as the kidneys, liver, and spleen, aims to evaluate their size, position, and texture. Enlargement or tenderness of these organs can be indicative of various underlying medical conditions, and identifying such abnormalities is crucial for diagnostic purposes. It helps identify organ abnormalities, guides further assessment and intervention, and supports a comprehensive evaluation of the patient's abdominal health. This practice is rooted in the principles of patient-centered care and early detection of potential health issues. 7. Assess for rebound tenderness last if the patient reports pain. By pressing deeply and gently into the abdomen with the hand and fingers downward, and then withdrawing the hand rapidly. Rationale: rebound tenderness assessment can help identify peritoneal irritation and is performed last to me. 8. Palpate and then auscultate the femoral pulses in the groin. Rationale: assessing femoral pulses provides information about vascular perfusion in the lower extremities, which can be relevant to abdominal issues. Detecting changes in the femoral pulse can help identify vascular abnormalities or obstructions in the arteries that supply the lower limbs, for example. A weak or absent femoral pulse might indicate arterial occlusion, embolism, or stenosis in the iliac or femoral arteries. Palpating and auscultating the femoral pulses in the groin during an abdominal examination serves as a crucial aspect of assessing vascular perfusion in the lower extremities. 1. Replace the patient's gown and assist the patient to a comfortable position. Rationale: ensuring the patient is comfortable and appropriately covered maintains their dignity and comfort. Medical examinations can leave patients feeling vulnerable, and it is the nurse's responsibility to ensure that the patient's emotional well-being is upheld throughout the process. Providing a gown and assisting with redressing helps the patient regain a sense of modesty and comfort after exposure. 2. Perform hand hygiene. Rationale: hand hygiene should be repeated after completing the examination to prevent the potential transfer of pathogens to the patient or the environment. Hand hygiene is not a one-time event but an ongoing process that should be practiced consistently throughout patient care after the abdominal examination. Performing hand hygiene serves as a critical link in the chain of infection control. Hand hygiene not only benefits patient safety, but also contributes to maintaining a clean and hygienic healthcare environment. Pathogens on healthcare providers' hands can be deposited on various surfaces, equipment, or objects within the patient's room. Adhering to established infection control protocols and guidelines is a fundamental aspect of delivering safe and quality patient care. It reflects professionalism and ethical commitment to patient well-being. Hand hygiene is an essential practice in healthcare that should be consistently and rigorously followed to protect both patients and healthcare providers. Performing hand hygiene after completing an abdominal examination is a crucial step in infection control and patient safety. 3. Document the findings of the assessment. Rationale: accurate documentation is essential for communication among healthcare providers, monitoring changes in the patient's condition, and ensuring continuity of care. Health assessment is a foundational skill in nursing that involves a systematic gathering of patient data to understand their overall health status. It encompasses various components, including physical examination, patient history, and subjective information, allowing student nurses to develop a comprehensive understanding of a patient's health needs. Health assessment serves as the cornerstone of nursing practice, helping student nurses identify health problems, establish baselines, detect deviations from normal, and provide patient-centered care. It equips student nurses with the essential tools to become skilled healthcare providers, ultimately contributing to improved patient outcomes and healthcare excellence. Thank you for your kind attention.